It's a pleasure to welcome you today to a very informative session with our guest, Matthew DeFaria from Sun Life Insurance Company. So welcome, Matthew.
Thank
My
you.
name is Thank you. My name is Vickiane Rodrigue, and I am the National Advocacy Lead with the Canadian Counseling and Psychotherapy Association. And with me is my colleague, Dr. Kathy Offit-Gartner, who is Regional Advocacy Lead. So, Kathy, would you like to introduce yourself to our members?
Sure. Good morning, everyone, or good afternoon, depending on when you're watching this. I am Kathy Offit-Gartner, and I am your Regional Advocacy Lead and I'm your President Emerita and a long-term member of CCPA. And I'm just thrilled that we get this opportunity to celebrate this major step forward with you today, and thrilled to have Matthew join us and walk us through.
Amazing. Thank you so much, Kathy. And in a moment, Matthew, I'll turn it over to you so you introduce yourself. But before we get started, something that is very near and dear to the CCPA are the 94 calls to action with the Truth and Reconciliation Commission. So wherever you are, we really want to do the traditional land acknowledgement. And so I just want to point out today that the land on which we gather, regardless where we are gathering in Canada, is the unceded and unsurrendered territory of the Indigenous, First Nations, and Métis people of this great land. And we recognize and respect that the Indigenous people are the past, present, and future keepers of this land. We value the contributions that First Nations, Inuit, Métis, and other Indigenous peoples have made, both in shaping and strengthening this community, provinces, territories, and our country as a whole. Chimigwech, merci, thank you. So Matthew, I'm turning it over to you, and I want to invite you to do your introductions as well, and just share the great news that we have with Sun Life about including registered psychotherapist, licensed counseling therapists, registered counseling therapists, Canadian certified counselors as eligible mental health practitioners through Sun Life. This is really an auspicious moment, an exciting moment for us all, and also being able to access your eClaims portal. So really great news all around. So over to you, Matthew.
Awesome. First off, hello, and thank you very much for having me today. I am Matt DeFaria. I am our Senior Marketing Manager on our provider engagement team. And like Vickiane alluded to here, I am going to walk us through the brand new eClaims portal that we have launching on December 1st this year for psychotherapists and clinical counselors out there, so they can start submitting and direct billing on behalf of their member patients. Really excited to do this. We've had a ton of feedback from mental health providers across the board in terms of getting this off the ground and up and running, and really happy to be here and be able to present this to the group. All right, so let me share my screen here. I'll walk us through a couple different things here. And we'll start here, which is our main provider hub. And here is where you're going to find everything that you're going to need to know for eClaims. And it starts really with a Sun Life Connect account. This is our central portal for all things provider related, everything from our provider search tool to our eClaims tool. So this is the main component that you're going to need in order to access eClaims for your members. And with that, on this page, you've got details on how to register for an account. If you have one already, great, you can log in directly here. Along with that, we've got a ton of tools, including videos on how to set up Sun Life Connect, how to set up eClaims, and then even all the way down to how to submit an eClaim for your members. On top of that, we've got support tools, FAQs, and resources, including an entire rundown on how to submit a claim from start to finish, as well as our details at the end with my team that helps support this, that can help you along the way. All right, so where do we start? How do we get things going? Really, you can get the ball rolling in three primary steps. One, set up or register for Sun Life Connect. Two, set up and register for eClaims. and then 3, start submitting claims. So we'll start with that registration process. And I think what we want to make sure is that if you have Sun Life Connect already, you've got maybe a provider search profile or you have one at your business, great. We're going to use that and you'll already have one and you'll be ready to go and get things going. If you don't, you practice independently or whatnot, the registration process is super simple. We'll walk through it really quickly here. I think the main component here that we want to know is a bit about what your role is at the practice. What we would ask, I guess, primarily here is if you are an independent provider, you practice independently, or you don't have a business insurance number, you want to select healthcare provider. Otherwise, you're going to go on and select whatever your role may be it the business owner, the office manager, or an administrator. We'll then ask you what details and what specialties that you offer at your practice. This will be important because that'll unlock specific features. So if you register today, you may not see eClaims pop up for psychotherapy, for instance. You can see it here. However, past December 1st, that won't be an issue, and that will pop up on your profile here. We'll then ask you for some key personal information, details, first name, last name, practice address, and then your terms and conditions. If everything looks good here, what you'll be able to do is then proceed to the next step. So I'll start filling these out. Go through the terms and conditions, and then hit next. Once everything looks good here, you're going to review the details. You'll receive an email from Sun Life to verify your email address, and then our team is going to process on our side just to make sure that there's no duplicate accounts in the system and make sure everything is good to go. Once you get that access, you are done from a registration standpoint and completed that first step for getting access to Sun Life Connect. Okay, next thing you're going to do is log into your account, and you'll see that this account is already set up for eClaims. However, in order to establish that setup for eClaims, you'll be able to see the full details within the video here. And we're primarily looking for a couple things. 1, business ownership information, and 2, banking details. Now, those banking details can come in the form of a void check or a bank issued statement. However, it needs to have a number of those key banking details included in it in order for us to set up that process. That'll then go to our team internally here for the eClaims round of validation. We'll validate on our side and make sure that everything is aligned and ready to go. Beyond that, you'll be able to then add and manage your providers and include anybody that you've got at your practice that you want to set up for eClaims. You can see here we have a number of providers included in here, but when you add a new provider, particularly ones that you want to process eClaims with, you're going to include a couple of key pieces of information in here, including their name, specialty, license number, license issuer, as well as the province. Simple as that. Key details for that provider to get them added into the system. And once they're added and approved on our side, we'll be able to start submitting eClaims for those providers. Once everything is set there, we've really completed then those first 2 steps. The first step being to set up and register for Sun Life Connect. The second step being to set up for eClaims. The last thing now, once you receive an email from us that you have fully been approved to start submitting eClaims, is to actually start doing that. So we can do that right up here and start the claims process. And the claims process is super simple. on our side here, what we're looking for is patient detail information. We'll start with who the provider is, so who you're submitting this claim for, and then enter in the plan member information. So I'm going to flip back over here because we've got a test account that I'm going to use. Okay, we'll say this claim is for a plan member, but you can also submit for dependents as well. Oh, wrong details. There we go, that's better. Next, we'll ask whether the plan is covered by another plan, because there are certain situations where you may be able to split that plan or that claim across multiple plans. We'll say no in this case. And then we'll choose where the service happened. Some of these things can be virtual, can be online, others can be in clinic, whether it was a workplace related accident, and then put in the details for the claim itself. Once you have that, we'll present the review screen, how much was submitted, and all the details around what the claim details were, and we'll hit submit. Okay, and that's it. You're done at that point. The claim is submitted, and we've got our details back that the claim has been processed. There's one key thing I want to talk about here, and that is related to some claims that pend. So pending claims can happen in the situation where the claim has not been automatically processed on our side and requires further review by our internal team. This can be for a multitude of reasons, whether the claim was flagged as a duplicate, whether the claim came through and that provider's specific plan does not allow for that member's specific plan, does not allow for eClaims and just needs to be reviewed on our side. The way you'll be able to tell is the claim has been processed, but there'll be further details up here that it hasn't been fully completed yet. You'll also see that the total paid to the provider would be 0 as well. Okay, so those are key things to look for. And I say that because in these situations, when a claim is pended, the member will be paid as opposed to the provider. Okay, that's important to note because then at that point, you still want to collect payment from the provider in these situations. They're very rare. They don't come up very often. However, it's important to note that at this point, if you do see that, that's the way that will be handled. Last thing I'll mention on this point is that we are changing that in Q1 next year. So it's a short-term thing that we'll have to manage in the meantime, but something that members should look out for regardless. And then you're done. You can submit another claim, or you can close this out and get on to the next patient. That completes the process on our side. Really simple 3-step setup for members. We've got our team's details, and I can provide them to you, Vicky Ann, as well. They're on the website as well in terms of who to reach out to if you need further support beyond this. But really about how do you set up Sun Life Connect, how do you then set up eClaims, and how do you submit a claim. Really easy to go back to this webinar as well as going back to that main provider hub for all the details they need beyond this point.
Amazing. Thank you so much, Matthew, for walking us through this. It's really great to be able to partner up with Sun Life and to be able to have that expanded coverage for Canadians from coast to coast to coast. We know that when Canadians can choose their mental health practitioner, it increases autonomy and therefore the efficacy and effectiveness of psychotherapy and their long-term wellness overall. So we just want to thank Sun Life for partnering up with us again and allowing this for Canadians. I think it's fantastic. One of the main questions that we often get is oftentimes psychotherapy or mental health services need a prescription. Would plan members, have to submit that prescription online?
Potentially. I think a lot of that comes down to the individual plan itself that member is a part of, whether or not those details are required. There is a component within this that you'll see it is included in there. If you need to attach details for a note, you should be able to do that in that claims process. Otherwise, the member can submit it as well.
Okay, wonderful. And what about registered psychotherapists, Canadian certified counselors, licensed counseling therapists, and registered counseling therapists? Is there, will there be a requirement for their credentials to be submitted so that they are covered? Or is it simply once they're registered with an account through Sun Life that everything should go smoothly as planned?
Yeah, I think once their license details are in there, and again, it comes down to the individual plan on what is included and what is covered. From a provider specific license standpoint, yes, once they're in that system and they have that, if you remember in the list of providers, you can see whether or not eClaims is active or not. If they have that in there, they're good to go. I guess an easy rule to think of too is if they are submitting claims with Sun Life right now, they'll be able to set up within the system here.
Wonderful. Thanks so much, Matthew. Kathy, do you have other questions that you think members might ask?
Absolutely. Thank you, Vic-Ann. And thank you so much, Matthew. That was very comprehensive. I was keeping a few notes, questions that I'm pretty sure we're going to get asked about. And just to follow up with what Vic-Ann just mentioned, we have several different titles across the country. As Vic-Ann has mentioned, licensed or registered psychotherapist, licensed counseling therapist, registered counseling therapists. And we understand that we will have more coming across the country with the BC close and perhaps Newfoundland Labrador close in terms of regulation. And then, of course, our Canadian certified counselors. So when you were doing the drop-down menu, I saw that you showed psychotherapist. So would we just assume that regardless of the title, whether they are a counseling therapist or a psychotherapist, would they just choose the term psychotherapist?
It's a great question. I think in this case, you want to split that out. We have it listed in our system as clinical counselors. And that's, for lack of a better term, our bucket for all non-psychotherapists.
Okay.
So I think if they're registering, I would think of it that way. If you are registered as a psychotherapist, Ontario, Quebec type of thing, then register that way. If not, clinical counselor is the approach you want to go with.
Okay. So that's going to be very helpful for our members so that they don't look at that and go, well, I don't see licensed clinical counselor or licensed counseling therapist. But if we know that clinical counselor, just out of curiosity, on your website, is there a definition? Like if you hover over clinical counselor, will it say all counseling includes various different counseling mental health providers or something like that? Otherwise, my guess is you're going to have a ton of questions about that because, of course,
we do get them now.
Yes.
Right now, in terms of the titling of it. And I think a lot of it is just legacy in terms of the way the plans were built out and the terminology that we started out using. I think because of BC or the clinical counsel title, and it's just been legacy essentially in terms of the naming convention on our side. And hasn't been expanded out. We don't have anything on the site necessarily, Kathy, to answer your question that hovers over and says this includes X, Y, and Z. But again, if they're submitting claims with Sun Life right now, and they are in any of those other categories that you listed off there, clinical counselor would be the bucket to select.
Okay, that's an excellent one for us, so we can make a point of really emphasizing that on our website. Another question that came up while you were going through was when you mentioned about clicking on the healthcare provider if they weren't a business owner or had a business license. So I just want to clarify, if someone is a sole proprietor, rather than putting in business license, and because again, as a sole proprietor, they may or may not have an actual business license.
True.
They will always have business insurance, or let's rephrase that and say anyone who's ethical and professional will have practice insurance. But when it just to clarify, when someone is operating as a sole proprietor, would they just click off healthcare provider?
Yeah, it's a great clarification point, and the reason I wanted to point that out, and I'm glad you brought it back up, is because everything in Sun Life Connect is facility driven.
Yes.
So you have a facility and you log in through that facility, and that's primarily designed in a way to allow for where that eClaims money is flowing. Is the facility being paid, or is the individual provider being paid at the end of the day? Because we know there's lots of situations where a psychotherapist could work out of a facility and they work there, and that facility gets the payments at the end of the day. There are also lots of scenarios where they just rent out a space at that facility, in which case that money flows through them. So they would have their own setup in that situation. And if you don't have a business insurance number, that's fine too. We just want to make sure that we're registering them correctly as healthcare provider as opposed to as a business owner. We understand at this point it's confusing in terms of the two because they are an individual business owner.
Yes.
We just want to make that distinction of whether they're a business owner with a business insurance number or not.
Okay. So again, we will emphasize that because a lot of our members are sole proprietors, or
Yeah.
as you mentioned, they may be renting space, but they are the
Totally.
business operator. And typically as a sole proprietor, or they could even be incorporated. But I believe that the majority would be in that sole proprietor. One more question that I have is I saw and I really appreciated when you were showing how to add providers. Can you now also articulate how would you remove a provider? So let's say that a practice has started, we've got 3 providers, we've registered all 3 providers, and now one provider has is moving on, etc. How would we go about removing a provider?
Yeah, another great question. I can show you too if that's easier. Can go back
Excellent.
into our test account. And it's really simple. We're going to use the same listing that we used before when we were managing providers. Same spot where we add a provider, we're also going to be able to make changes to existing providers. So if we go at the top menu here, we can see providers. We're going to click Manage Providers. We're then going to get our list. You can see ones here where David Miller, we don't have eClaims set up yet, or we don't have a provider search profile. Here's where you're going to be able to manage all of those things. And then here, if you click on these 3 dots here, this is our little edit button for each of the individual providers. And you can see delete provider is an option there.
Excellent. Okay, really easy. But I wouldn't have guessed what the 3 dots were. So I really appreciate that you show
Good
us.
question. Good question.
Because, you know, as someone who has owned a business in the past and had providers underneath me, it's not always, as sometimes it was difficult to remove someone, and then it got confusing when they were still under my account and
Sure.
under their own. And it created a stall for the rest of the individuals that were part of my joint business. And the last thing that came up for me is once a claim has been put through, I saw that there was a CPN number and there was a little button to print a receipt. And in
Yes.
terms of, I'm thinking about how each provider manages their amounts that are owing to them, because of course there's always a bit of a delay. We know that companies tend to pay, you know, on a regular basis, whether it's a biweekly, bi-monthly, etc. What would you encourage providers to do? Would you encourage them to print the receipt, or screenshot that page, or write that CPN number down? I'm thinking of if they ever had to dispute payment or follow up in terms of payment, how would they go about that kind of accounting, accounting from a dollars and cents perspective, but also the number of claims that are outstanding?
That's another great question, and I didn't get into it, but we can here. And I just wanted to see if we had anything in our test account in terms of details. I'm not sure that we do, but we can check here. What we also have in terms of a feature, Kathy, is the ability to check claims history.
Excellent.
You can see here right under submit a claim, and whether these control numbers and these details are added into a practice management system or a central accounting system that the individual facility or individual provider is utilizing, they can do that, but then they can also see all of those details here. I don't have any details in our test account right now, but they'll be able to pull up that history by date range in order to see. I wonder if I just did today's date. I don't have any details in here, but here's where you'll have all of those listing, and you can see by provider, by facility. You'll have that control number that you mentioned, deposit ID if that's been processed at this point, the status of it, and the submitted amount. Oh, we do. There it goes. Just took a while to pop in. So you can see all of the details here, and then that way you don't need to have to print out those receipts and keep them on file. You have the details right here, and then you can match that in your systems, whether it be your practice management or accounting details.
Excellent. So I do see that if, for example, I had recorded that CPN number, even if I was just doing it according to the CPN numbers, that would be one way of getting in there. The other way is by facility name or by date. So there's lots of ways to access this history.
Correct. Yeah. If you want to pull up an individual one, you can. You can do it by date range, and then you can sort it out by provider or facility, or whatever you may have. Excellent.
Thank you. That's those were the questions that came up for me for extra clarification. Is there anything else that you might have thought of, or you, Vicky-Ann?
Nothing on my end. Matthew?
Nothing from my perspective. I think, just starting with that provider hub, just as a reminder there, head there to get started and sort through where you fit, if you've got a Sun Life Connect account or not, how to get registered. And then that could be the central spot for your starting point on the videos and how to do things, as well as this webinar to get the ball rolling.
Excellent.
Excellent. Well, thank you so much, Matthew, for joining us today. Thank you for doing the step-by-step process for our members. So to our members, this video will shortly be uploaded on our website so that you can have access to it anytime. Et pour nos membres qui sont francophones et qui auraient besoin de la vidéo en français, nous nous engageons de pouvoir vous la fournir soit avec des sous-titres en français ou bien de le faire doubler en français. Donc, ça prendra un certain temps, mais soyez sans crainte, nous allons vous l'offrir sous peu. So thank you again to the both of you. Thank you for the time that you took to be able to do this presentation for our members. And we are so delighted to be able to partner up with Sun Life. And this is so exciting now and moving forward, not only for members, but for Canadians from coast to coast to coast. So thank you.
You're welcome.
Excellent.
Of course. Thank you too.
All right. Thank you very much, Matthew.
Bye-bye.
Bye.